Hello, future nurses and medical enthusiasts. Welcome back to medico.x.nursing. Today, we are taking a journey through the gastrointestinal system, also known as the GI tract. We will break down the anatomy step by step and look at the most common disorders you will see in your nursing practice. Let's dive in. First, let's look at the anatomy. Think of the GI tract as one long, continuous tube starting from the mouth and ending at the anus. Its main job? To break down food, absorb nutrients, and get rid of waste. The mouth? This is where digestion begins. Chewing and saliva start breaking down the food. The esophagus is the food pipe. It uses muscle contractions called peristalsis to push food down into the stomach. The stomach. Think of this as a highly acidic blender. It mixes the food with gastric juices to break it down into a liquid called chyme, pronounced chyme.
The small intestine. This is the star of the show for absorption. It is divided into three parts: the duodenum, jejunum, and ileum. The large intestine, or colon. Whatever is left over moves here. The colon absorbs water and forms solid waste, which is then eliminated from the body. Accessory organs. We also have helpers. The liver produces bile to digest fats, the gallbladder stores that bile, and the pancreas creates enzymes to break down sugars, fats, and starches.
GERD, or gastroesophageal reflux disease, is chronic acid reflux where stomach acid flows back into the tube connecting the mouth and stomach, the esophagus. This continuous backwash irritates and can damage the lining of the esophagus. Peptic ulcer disease PURMAS, open, painful sores that develop on the inside lining of the stomach or the upper portion of the small intestine. They are often caused by an H. pylori bacterial infection or the prolonged use of pain relievers NSAIDs.
Bowel disease. Inflammatory disease, or IBD, is a group of disorders involving severe chronic inflammation of the digestive tract.
Crohn's disease can affect any part of the GI tract, while ulcerative colitis affects only. This inflammation can lead to permanent damage and severe complications.
Irritable bowel syndrome, commonly known as IBS, is a functional disorder that causes cramping, abdominal pain, bloating, gas, and changes in bowel habits.
And irregular bowel movements. It does not cause permanent damage to the intestines.
Understanding this anatomy makes it so much easier to understand the disorders. If you found this breakdown helpful, please hit that like button and subscribe to medico.x.nursing and share this with your nursing study group. See you in the next video.